You're listening to Razorcast, USA's hottest podcast, bringing you cutting-edge interviews from leading industry professionals.
This is Liz Harvey coming to you from our Razorcast studios in New York City, where we are dedicated to bringing you cutting-edge interviews from many of the leading industry professionals across the U.S. In today's episode, we are speaking with Matthew Phinney. Dr. Matthew Phinney is the founder of the Chiropractic Doctors in Grand Rapids, Michigan, where he is committed to improving the health and quality of his community through chiropractic and wellness care. He is originally from Ontario, Canada, and he graduated from Bishop's University in Quebec, Canada, and then from Palmer College of Chiropractic in Davenport, Iowa. Dr. Matthew Phinney is widely considered to be one of the top chiropractors specializing in holistic and alternative health in the country, and he is also a contributing member of our national network of industry professionals. Today we are going to talk about a very important topic, neck pain and stiffness. Hello, Dr. Phinney. How are you today?
Hey, Liz. Doing great.
Thanks for being here. Oh, great. That's awesome. Thanks for being here. And our first interview today is about neck pain and stiffness. So I'm going to dive right in. Okay, can a stiff neck work its way out and not need intervention from a chiropractor? And is it common to see patients for neck pain?
Yeah, that's a great question, Liz. I'm glad that you asked that. It really depends on what your definition of working its way out is. A lot of times when people will come into our office, yes, neck pain is one of those common things, but usually it's been one of those things that's been going off and on for a period of either months or years. And so a lot of people think, well, when the pain goes away, the problem is gone. So typically anytime there's some sort of pain or discomfort, it's your body's warning system. Your body's telling you something's not working or something's not doing what it's supposed to do. And so anytime there's pain that comes and goes, it usually means that there's some sort of physical problem either being caused by something that you are doing or something that you're not doing. And so that's always a concern. And so the reason why pain would typically come and go like it does or work its way out and then come back is when you look at the nerves and the nervous system, the sensory portion or the feeling portion of a nerve really only compromises about 10% of that nerve fiber. So the remaining 90%, 45% of that goes to supply muscles. So your muscles contract, they relax for you to be able to move. And then the other 45% of that 90% of that nerve, that goes to your organs and glands. And so your organs, glands, they're producing different functions, different chemical hormones in the body. They determine our emotional state. That stuff is all controlled through the nervous system. So what that really means is that you can have pressure, you can have compression on up to 10% or 90% of those nerves and not necessarily feel anything. And then it's all of a sudden now you're on that 10%, that sensory, that feeling portion, and you're like, oh my gosh, I'm in excruciating pain. And then what happens is that pressure can back off. It can go on to, say, the motor portion or it can go on to the organ gland portion, and you don't necessarily feel anything. And that's what I would call like the blessing and the curse of the spine or of the neck. Blessing in that, yeah, you don't have pain all the time, but curse in that can be a problem that sort of comes and goes for a period of, say, months or years, and it's doing damage to your body and you're not necessarily aware of it. And so that's why oftentimes things can become much worse over a period of time or we don't do anything about them because we think, hey, the pain's gone, everything must be fine now.
Mm-hmm. Okay, and do you see a lot of patients, do you personally see a lot of patients in your office for just a common neck pain? Is that what brings them in?
Yeah. Mm-hmm. Yeah, neck pain is very, very common with everything that we're doing in today's society. The text messaging, the on the phone all day long, staring down at our iPads or our notebooks or computers, that stuff, all those types of activities that the majority of us are doing on a daily basis put a tremendous amount of stress and strain on our upper back and neck. And that's a recipe for pain and discomfort. Not to mention all the other stuff that's out there, such as sports injuries, car accidents. There's a lot of people out there that are suffering with with neck pain, and they're not necessarily sure what's causing the problem and if there's anything that they can do to correct it. So that's why we do get a lot of people that come in with neck pain.
And my next question was going to be, how can we avoid neck pain? And you started tapping into that already. So could you expand on ways people can avoid neck pain?
Okay. Yeah, great question. There's a lot of, again, different lifestyle behaviors that can contribute to having pain in the neck. I'm going to touch on a couple of them. One of the big ones would be sleeping position. 1/3, if you're lucky enough to get 8 hours a day, I don't know if you do, but if you're getting 6, 7, 8 hours of night sleep every single night, well, that's basically 1/3 of your day in one specific position. And so sleeping position can play a big role in whether or not you would have pain in your neck over a period of time. One of the things we always recommend is sleeping on your back. A lot of people out there that have neck pain or that had chronic neck pain will find a lot of them are stomach sleepers. Because I don't know about you, but if you sleep on your stomach, you either have to have your head cranked and twisted all the way to the left, or you have to have it twisted all the way to the right all night long. You can't breathe through your pillow. And so if you even just sat there, like if we're talking right now, Liz, you sat there and turned your head as far as it could go and you held it there for a minute, you'd probably have a pretty stiff or sore neck even after that just 1 minute period. People are doing that 6, 7, 8 hours a night. So sleeping on their back is one thing that I would definitely recommend. For the people that are sitting at a desk all day long, the height of your computer monitor, the height of your screen makes a big difference. If you're sitting there and you're staring down at a computer screen, or you're staring way, way, way up at a computer screen, again, 6, 7, 8 hours a day while you're at work all day long, that can put a tremendous amount of stress and strain biomechanically on the neck. So having that monitor height so that your eyes are level with the top 2/3. So if you were to break the monitor up into, say, 3 sections, your eyes should be at that top 2/3 in terms of height there. Mm-hmm. The other thing I would recommend if you're on the phone all day long would be, or even your cell phone all day long, would be to use a headset. So your head's not twisted or your shoulder's not stuck to your ear all day long. Again, that can put a ton of stress and strain on the spine. One of the other things we recommend is like a spinal hygiene protocol. So everybody, you brush your teeth today, right? I hope.
Right.
Everyone,
yes.
You do that, and you didn't do that because your teeth hurt. You do that because you want your teeth to last. You want a nice, healthy smile, and it makes sense. And so the same thing, we in our office, we recommend there's a specific spinal hygiene protocol. Because just like dental hygiene, you want to take care of your teeth every day because it should last as long as you do. The same thing is true with your spine. And then the last thing would be, get your spine checked, see if there's any sort of subluxation, anything that's not working or doing what it's supposed to do. Get it checked, and if there is something going on, then that's something that can be corrected through a gentle and specific adjustment.
Mm-hmm. Okay, that sounds great. Next question is a little different. Is it known? No, it is known that a stiff neck can be a warning sign for a serious infection like meningitis. I know we hate to think about that, but for the average person, is there a difference in the type of neck pain for something serious like a potential case of meningitis versus, hey, my neck just really hurts, I just have a really stiff neck? So how would someone interpret that kind of neck pain and maybe know there might be something else going on?
Okay. Yeah, that's, again, another great question. Meningitis. So what they're referring to with the case of, say, meningitis is there's layers of connective tissue surrounding the spine and the spinal cord. They're called meninges. And anytime there's a structure in the body that gets inflamed, they add that 4-letter word itis, I-T-I-S, on the end of it. And that really means inflammation of whatever it is that we're talking about. So meningitis is inflammation of the meninges that are surrounding the spine. It could be either a bacterial or a viral infection. The one that's typically more dangerous is the bacterial type of meningitis, and that's something that you definitely want to be cautious about. And there's typically other signs and symptoms that would go along with something like that. So almost always if somebody has a case of, say, meningitis, or they've contracted meningitis, it usually is accompanied by a fever, usually something greater than, say, 103 degrees Fahrenheit. The other thing that they'll typically have is they'll have a severe headache along with that. A very severe headache, like a headache that they've never experienced before. Another sign and symptom that it could be potentially meningitis is they would have vomiting. So they'd be sick to their stomach. So it can mimic a migraine type headache. They'll also typically have with it like photophobia, so light sensitivity. So they don't want to see any light. And then along with that, the neck pain and stiffness. So there's a couple different orthopedic tests that you can do, but if the neck is super stiff and sore, and you have any of those other 4 symptoms that I just spoke about, that would be a situation where I would say go with what your gut tells you, and if you feel extremely lethargic, like you can't move, you can't do anything, then that would be a situation to go get it checked at, say, the emergency room, just to make sure that you're erring on the side of caution.
Right.
But I really, I tell people trust your instincts, trust your maternal instincts. We've been on this planet for thousands and millions of years. It's not because of public policy or these rules that are set in stone. It's that we have those instincts. And so just kind of trust your gut and listen to what it's telling you. But look out for those things. Be educated as well.
Okay. And the next question I have is regarding chronic neck pain. Do you see the benefits of neck strengthening or neck bracing for somebody suffering from, say, chronic neck pain that just can't seem to go away?
Yeah, great question. The one thing I will comment on as far as bracing, because I get that people ask me a lot of times, well, what do you think about a back brace? Or what do you think about an orthotic? Or what do you think about a neck brace? Anytime that you brace something in your body, anytime you put a brace on something, what do you think happens? Do you think your body has to work harder, or do you think your body has to do less?
I would say do
question,
less.
Obviously.
Yeah.
Correct.
I don't know. I would say do less because it's being constricted and confined.
You got it. And so anytime your body's forced to do less or function less, and it's relying on some sort of brace, well, then what happens is over time, it will get weaker. And the weaker it is, the less strength that you have in that area, typically the less function that you have, and the more you open, say, something up for, again, continued chronic pain and discomfort. So as far as neck strengthening goes, yeah, that is a good thing to do, but there's a specific way that you want to go about doing it. And that's what I was referring to earlier when I spoke about a spinal hygiene type protocol. And so you definitely want to have somebody sort of walking you through that and giving you the specific exercises that you need for your specific structure. And these are all things that we would do in our office because, yeah, once we fix a problem, once we've corrected something, we want to make sure that it doesn't come back. And the stability portion of care is a big, big, big part of that. And so, yeah, without a doubt in my mind, I think neck strengthening, stability is great, but we typically start with mobility first. So we have a mobility, stability type spinal hygiene protocol, but that's all based on specifically what's going on with their body structure and function.
Okay, that sounds great. And my last question for you is, can a headache be the culprit for neck pain? So say you start with a headache and then all of a sudden your neck starts to hurt. Is that common? Is that a true statement? Can you talk about that?
Yeah, great question. That can happen. More often than not, what we'll typically see is people that have neck pain will also have with that an associated headache. And so the reason why is when you look at the cervical spine, when you look at the neck, there's 7 movable bones in the neck. Every single human, every single animal, every single mammal, they all have 7 bones, 7 cervical vertebrae in their neck. And exit coming off of the cord between every 2 bones, you have these spinal nerves, and they're the ones that circulate, they go throughout the entire body, but the ones in the neck are the ones that control all of the function of the head. So the eyes, the ears, the nose, the brain, the brainstem, muscles of the face and the scalp. And what can happen with some of those things that we talked about earlier, that something can shift or twist out of alignment, and it can put pressure on those nerves. Now, you may not necessarily feel pain right away, but it could manifest or it could show up as something like, say, a headache. One of the easiest ways to tell is if you're sitting, or if the people sitting at home are listening, if you grab or just sit up straight and you take your thumbs and you put them right into the back of the base of the skull, right where your skull comes into your neck, and you poke in there, and if it feels stiff, if it feels tender, if it feels sore, that usually is an indication that there's muscle spasm there. And muscle spasm is usually the result of pressure on that motor or the muscle component of the nerve. And that can, over time, typically cause things like headaches to develop. And so most people, when they get a headache, they reach for some sort of medication, right? An Advil or an ibuprofen, or even some of the stronger stuff. But it's not necessarily correcting the problem, because about 90% of the headaches that people are dealing with are mechanical. They're structural in nature. The remaining 10%, there's a dietary component. It could be a psychological component, but 9 times out of 10, they have a structural issue. It's a nervous system issue, and that's why we have the results that we do at actually getting in and correcting the cause of that problem so that the headache goes away and doesn't come back.
Okay, I think this is really good information. There's a lot of people out there that suffer from neck pain, headaches, things like that. So this information's been really, really helpful. So thank you so much, Dr. Phinney.
Yeah, my pleasure. I appreciate you guys having us on.
Okay, and for our listeners across the country, if you are interested in speaking with Dr. Matthew Phinney, you can either go online to www.thechirodocs.com or call 616-432-3103 to schedule an appointment. And on behalf of our entire team at Razorcast, we want to thank you for listening, and we look forward to bringing you more top-quality content from our country's leading industry professionals.
You've been listening to Razorcast, USA's hottest podcast, bringing you cutting-edge interviews from leading industry professionals.